Hi there, thanks so much for joining us. I'm Nick.
And I'm Helena, and we both work here at the MS Trust, which is a charity for people affected by MS in the UK. We are here to try to help you make sense of MS.
Yeah, and thank you for joining us on our podcast. This is Multiple Sclerosis, Breaking It Down. And today we're going to be having a think about this term that some people call limbo land. So it's that time between starting to sort of experience your first symptoms and seeing a neurologist, but then also that time when you're waiting for your test results and you're trying to figure out what's going on.
This is such a stressful time. I remember mine very clearly, even though it was very, very many years ago now. There's like lots of weird things going on. Sometimes there can be painful things and disabling symptoms, and you really just want answers, really.
Yeah, I can imagine, Helena. It must be so stressful not knowing. So that's why later on I'm going to be talking to neurologist Dr. Emma Tallantyre. She works in Cardiff, and she's going to tell us basically what's going on at this time, why it can sometimes take a period of several months, and the things that you can do during that time to help yourself whilst you're waiting.
I'm really looking forward to hearing what Emma says later on, because, like I say, it is such a stressful time for so many people. I mean, most time we hear about people getting diagnosed, or in some cases not getting diagnosed, because obviously it doesn't always turn out to be MS. I guess it's important to point out. We get a lot of people coming to us in this time, and they will either call up the information, the helpline, or they will talk to us on Facebook, and they will sort of ask all kinds of questions to the MS community. What's going to happen now? What can I do? What should I be doing? What's the next step? There's so many questions.
Yeah, and we do see that in our online communities as well, don't we, Helena? So in our Facebook group, it's one of the sort of the top questions that people talk about, isn't it? The what's going on, what should I be doing? And obviously, you're going to be under a huge amount of stress during this time with worries about your symptoms, about things like what the treatment will look like, if you have MS or not. There's lots going on, isn't there?
Yeah, and I think I've heard a few times as well, especially if people don't know much about MS, they might, have some distant memory of hearing about MS, or they've known an older relative with MS, and they might have some really sort of horrific ideas about what it could be. So, and then you can, we always say this: don't go and consult Dr. Google about some of these things, because sometimes people would sneeze and they would go and look it up on Google, and they would diagnose themselves with some tropical disease. I mean, it can be very easily done, can't it? Especially when with MS having so many weird symptoms as well. It's quite it can be very, very scary. And I think it's so important to sort of point out that when you're in this, what we can call like information gathering time of your life, or a mission. And I was very much there myself back in 2006. And that was a little bit before Facebook. Well, I don't know when Facebook started, but I certainly didn't have Facebook. So I remember diving into one of these online communities, and you sort of almost ask them, what's wrong with me? Can you diagnose me? What's happening? And even back then, most people were very sensible and sort of say, you need to go and talk to a doctor. Nobody here can sort of tell you that it's MS for sure or not. Because people are helpful online, but 99% of the time there's not going to be a health professional that you're talking to. It will be somebody living with whatever condition you're trying to look up. So don't think that you can get a diagnosis from Dr. Google or a Facebook group. That is just through the neurologist.
Yeah, I feel like I always end up doing that, Helena, with any like health thing. I'll end up self-diagnose myself from WebMD or whatever. But no, it's definitely important to look at the trustworthy information that's out there. So if you are worried about MS, or your doctors are having those sort of conversations with you that what you're experiencing might be MS, head over to our website. So that's mstrust.org.uk. You're going to find lots of information on there about that that period between your neurologist appointment and your diagnosis, early diagnosis. And also you can contact our helpline as well. We'll make sure we link to all of this in the show notes. But if you do have any questions, do get in contact. I think, as Helena was talking about, the sort of the online communities and not diagnosing yourself through those, it's also important to just take a note that actually we're not able to diagnose either. We might say, go away and ask these questions, or here's this information. But that will be down to your neurologist and your team.
Yeah. And speaking of neurologists, shall we? I really want to listen to your interview with Emma now. So should we stop talking and get listening?
Absolutely. Let's go. Hi and welcome back. We're joined by Dr. Emma Tallantyre. Hi Emma, how are you?
Hi, I'm well, thanks.
For anyone who's unfamiliar with yourself, would you be able to introduce yourself for our listeners?
Of course I would. So my name's Emma Tallantyre and I'm a neurologist and also a researcher, and I work in Cardiff, mainly looking after people with multiple sclerosis.
Amazing, thank you. And today we're kind of talking about that period of time where someone might go and see a neurologist, and then there's the diagnostic process happening, and that kind of time of uncertainty for a lot of people. So from your experience, what can people expect from seeing a neurologist and that time in between then and potentially getting a diagnosis?
Yeah. So when we see people in clinic for the first time as a neurologist, really what I'm focused on is hearing the story. And that's for a couple of reasons. First of all, we really need to understand that someone's symptoms are compatible with MS. They sound like MS and it doesn't sound like something else. And then the other reason is obviously we want to understand how the symptoms are affecting people. And, they might be impacting on work or life or driving or, so that's important as well. Now, after we've made that assessment, we usually examine people in the clinic. And again, that's really helpful for us to understand whether someone's examination findings of their arms and legs and things is in keeping with MS or whether it points towards a different diagnosis. And then it's also important because we can make some measurement of how severely someone's affected at that point in time. So once I've finished in the clinic, usually what will happen is I'll agree a plan with that individual that's along the lines of some tests that really need to be done to try to support the diagnosis. So it's probably worth at this point me just explaining a little bit about how MS is diagnosed so that people can understand the sorts of tests they're likely to be asked to have. So the way that we diagnose MS is that we listen to the story and we want to primarily know that someone's symptoms are in keeping with the diagnosis of MS, and that's really important. So it's not all about the tests, it's a lot to do with the story. But in someone that has a story that sounds compatible with MS, we do need support from some tests. And the main two tests that we do would be an MRI scan, and that could be of the brain or it might be of the brain and the spinal cord. And then the other test that people are often asked to consider is a lumbar puncture. And that's because the spinal fluid that we collect when we do a lumbar puncture tells us a lot about whether there's inflammation happening in the central nervous system. So the sorts of things that happen after I see someone in clinic is that they will have some correspondence with the hospital about appointments for MRI scans and possibly for a lumbar puncture. And then there'll be a period when I'm collating all the results from those tests and preparing to meet the person or to speak to them on the phone to explain what's been found. And I think it's important to say that in that time, different teams operate slightly differently about whether they introduce that person to the MS team. So when I meet with someone in the clinic on the first occasion, I might be quite confident just from the story that this is going to turn out to be MS. And they may already have had an MRI or even a lumbar puncture done by somebody else. That might give me a little bit more confidence about the diagnosis. But when to introduce that person to the MS team is sometimes different in different places. Sometimes the person or the team might feel more comfortable only being introduced once the diagnosis is very secure. So I think sometimes people are faced with a situation where they're undergoing the tests. They've been told that it's almost certainly going to turn out to be MS, but they haven't really been formally introduced to the wider team of people that will be looking after them yet. And I think that sometimes leads to a slightly difficult period.
Yeah, absolutely. I can imagine that must be really difficult for lots of people, and as you say, it can vary from team to team. So thank you for sharing. And this process can sometimes take a long time.
Yeah.
What are the reasons for that?
Yeah, so normally when we see someone in the clinic, I suppose we might expect, if they haven't had any testing done yet, and we're starting that process, I might expect that to take some weeks or possibly months. And the reasons for that are a few. One is that there are sometimes more than one test that we need to do, as I've mentioned. So in our particular hospital, the wait to get an MRI scan from the time of requesting it is about 3 months. Depending on the, urgency of the situation, sometimes we can get them done sooner, but those are the sorts of waiting times that a lot of places across the UK are facing at the minute. So sometimes there's a bit of delay in having the test. And having a lumbar puncture is normally organised on a sort of day ward. And that day case admission, again, the waiting lists can be some weeks or sometimes some months. So there are the delays in having the test. Now, once the tests are done, there is a little bit more of a delay because, for instance, the MRIs then have to be reported by an expert called a radiologist, and then the report would come back to me, and all of those steps take a little bit of time. And likewise, the spinal fluid that's sent to the laboratory, the testing is sometimes not done immediately. Sometimes they batch those tests. So the testing may be done after a week or so. And then again, the results take a little bit of time to come back to the neurologist. So those are some of the reasons why that period can take a while. And then the other thing I think it's worth mentioning is that the other thing that we're doing as a neurologist, apart from listening to the story and looking at the MRI and the spinal fluid tests, we're also trying to make sure that there isn't any other better explanation for these symptoms apart from MS. And actually, it very much depends on the individual how involved that process is. So if somebody has a lot of complexity about their presentation and some sort of hints or signs that maybe there is something else going on, that can actually take quite a lot of time to explore and be able to be adequately excluded. So that can lead to some other delays, but those would be the main reasons.
Yeah, just making sure that, everything's in line and that, everyone's from those tests and etc. It must be a lengthy process that, you must want to get as accurate as possible. So it's completely understandable, isn't it? For people who are going through this phase, there might be, some worry happening. Is there anything that they can do during this time?
Yeah. No, I think that's right. I mean, I really feel for people in this phase, I would say, because I think uncertainty is often the worst thing. I mean, it's often interesting as a neurologist when you meet people and sometimes you're giving someone a diagnosis and almost apologetic that, I'm afraid to tell you that this is MS. And actually what you often hear is people are quite glad to hear it because what's been really hard so far is the uncertainty of just not knowing. Yeah. So actually, once you're certain, you can learn about treatment. You can understand that, much of MS is treatable. You can start to meet the team who'll look after you. You can start to read about things, speak to family and friends. So I do recognise that uncertainty and that limbo period is really hard. So I think it's very variable how people feel about reading about MS, but I would probably encourage people to think about doing some reading. I think some people understandably say, I don't really want to read about MS until I know that I've got it for sure. But I think by delaying that, sometimes there can be this uncertainty builds into a sort of fear of something that might be a lot worse than it actually is. So I guess the reason I'm saying that is that MS is a treatable condition now. And I think by reading, there are some really good resources, particularly on the MS Trust website, also on the MS Society website. And I think those trusted information sources usually bring a lot of reassurance and a lot of clarity. So I would often encourage people to read about it. There is a hypothetical, situation where people will do a lot of reading and then eventually they'll be told they haven't got MS. But I think that's probably better to have that outcome than to live with a lot of uncertainty. The other thing I'd suggest is that writing things down and speaking to people around you. So often people have this slight vacuum of time when they're waiting to see the next neurologist or nurse. And I think there's lots of things going through people's heads. It's quite an uncertain time. Writing down what are the most important things to me, what are my questions, but also what are my biggest fears? What are the things that I worry that MS might change about my life? Because that's really important when you next meet your healthcare professional, that you can sort of say, look, the reason that this is being a worrying time for me is that I particularly want to know about this. And that'll be different for everybody. And I think also, speaking to people is very helpful. Now, some people will also say, well, I don't really want to burden my family. They're already worried about me, and they keep things more or less to themselves. But I think it is really important to try and find some trusted people around you that perhaps you don't feel you're burdening quite so much by sharing with them. But just being able to talk through some of the worries is really important. And then the other thing you can do is there are lots of benefits to people with MS from dealing with various lifestyle issues. So, having a healthy diet, aiming for a healthy body weight, making sure that, you're not smoking, that you're taking some exercise. You might think about taking some vitamin D just on the sort of recommended daily allowance for the whole population. So those sorts of things are things that are going to benefit your general health anyway, but there is some evidence that they will particularly benefit MS. So again, people are often quite interested to think about, is there something I can feel like I'm doing while I'm waiting for these results?
That's really helpful advice. Yeah, those sort of actions that people can take, and sometimes actually that will just help some of those worries. And also I like saying about writing some of those worries down so that your next appointment, because your head's probably going to be swimming with all kinds of different thoughts at this stage. So and making sure that you address them. So thank you. And should people be concerned about their MS getting worse during this time if they have it? Yes. Yeah.
Okay. Yeah. So I think that is a worry for people. I mean, I think there's sort of two ways to look at it. I think that, of course, now, that we know that MS is treatable and that there are many things we can do, we don't want to delay this process. We want to speed it up as much as possible. So usually you'll find your neurologist and your other healthcare professionals are really going to work as hard as they can to give you an answer as quickly as they can. But I think, inevitably people will say, well, all this waiting, am I just waiting and things are getting worse in the background and we're not doing anything about it? But there's a couple of things I'd say on that. Sometimes the delay, the way that the MS diagnosis is made is that if someone presents with their first ever bout of symptoms, what we're often looking for on the other tests is we're looking for some evidence that this isn't going to be just a one-off. We're looking for evidence that something else is happening to tell us for definite that this is a multiple sclerosis problem and not just a single event. And actually, the people where that's hardest to prove, funnily enough, is the people in some ways that have the mildest disease. So if somebody had, let's say someone wasn't keen on a lumbar puncture, which not everybody is, and they said, well, I've had one scan, but you're telling me that I need some evidence on a second scan that something else has happened. Well, often we need to give that a bit of time. So we might wait 3 or 6 months and do another scan. And if we see a new patch of inflammation in the central nervous system, we can often say with certainty, okay, this confirms this is multiple sclerosis and this isn't just a one-off. Now, if you imagine the contrasting situation and someone has their scan in 3 or 6 months and it's entirely stable and there's nothing new, I can't give someone that clarity, that definite diagnosis, but I can book another scan for perhaps another 6 or even 12 months and say, look, let's look again and see whether there's something new. Now, those people, occasionally I do look after people where they might have 2 or 3 scans that are stable and then stable and then stable. And what does that mean? It means 2 things. One is that sometimes the diagnosis is even more delayed because I'm not able to give that definitive, look, we've seen a second lesion, a second thing has happened, we can be sure this is MS. But actually looking at it, the flip side, these are the people that in many ways have the most reassuring scans because the disease isn't running away from us. Things are appearing stable from scan to scan, from month to month or year to year. So I think there's often this sort of paradox where the people that are in limbo for the longest, ultimately, many of them still will turn out to have MS, but they will often have had the sort of mildest MS at the beginning. So I think that's important to remember because, when we're talking about, is there a missed opportunity for treatment or is the disease just getting worse under the surface and we're not doing anything about it? I'd say usually that's not the case. And we can talk a little bit more about, starting on treatment and the timelines for that.
Yeah, so moving on to treatments then, Emma, if that's okay. So, could you tell us about the delay in starting a disease-modifying drug? Is there any potential of impact from a longer delay?
Yeah, so I think what we know now is that by lots of research, we know that if we start the treatments in the early phase of MS, people do better. So if we meet someone that's had MS for 20 years and we start an immune therapy, the benefit will usually be less than if we meet someone who is a year or two after their first symptoms. So there is this suggestion that we should start sooner, and that's supported by research. But I would say that we're talking about as soon as possible. And usually, some of the data suggests that if you can start treatment within the first 5 years of your first symptom, that would make a difference from if you start treatment when you're sort of 5 years in from your first symptom. So we're not necessarily talking about weeks or months making a big difference on the scale of things. We're talking about not wanting to send someone away and leave them for many years to come back to us before they start, if that makes sense. So that's the first thing I would say. The other thing I would say is that when people make these choices about treatments, they have to feel sure and they have to feel like they've had adequate time to think about the risks and the benefits, how it's going to impact on their lifestyle, what taking a treatment means to them. And those things are, they deserve a bit of time. Now, sometimes what I've seen is, we do make a big effort to diagnose people as quickly as we can and to really offer treatment as quickly as people become eligible. And sometimes I think when you do that as quickly as you can, and you might have someone that has their first event, they come in and have tests and they're done, ever so quickly, and we get the results, we confirm the diagnosis, we talk about treatments, and we start a treatment. And let's say in the shortest instance, that might all happen within a period of a couple of months or something. Sometimes people have reflected to me and said, actually, that was such a whirlwind of a time. I don't think, looking back, I really had the headspace to consider what I was doing, and I've ended up on this treatment, and it's fine. But actually, I probably could have done with a little bit more space just to adjust to having MS, to have a proper read about the treatments and think. So I would hope that in this day and age, we do strive to diagnose people and start treatment as quickly as possible. But actually, I think there is a little bit of a need for a little bit of time just to allow people to adjust to having MS, a little bit of time to really feel like they've adequately had a chance to digest the information about this wealth of treatments we've got. And I personally don't think that waiting, some weeks or perhaps even months just to allow those things to be done properly, I don't think that should disadvantage people.
Thank you. Yeah, that's really reassuring to hear. We sometimes hear around this phase the phrase "time is brain."
Yeah.
Would you be able to tell us what that means and what that kind of refers to?
Yeah. Well, time is brain. I suppose it's been borrowed a little bit from the stroke sort of scene, if you like. So when people have a stroke in the community, we really want them to get to hospital as quickly as possible because we say, well, time is brain, the faster you get your treatment. So I think we've borrowed it a bit from that. But I think it does, lend itself in some ways to MS. But I think because it's been borrowed from the stroke field, in terms of someone having a stroke, we're really talking about, getting an ambulance and urgency and, getting treatments into them very quickly in the A&E and things. So I think we need to understand that in using that analogy in MS, we are talking about a bit of a different time frame. And as I've said, time is brain in MS means I think that if you present with your symptoms now, you want to try and have a diagnosis and some clarity. And then you also want, within the next 6 or 12 months, you really want quite a clear idea of how active is my MS. And that's really according to your symptoms and according to your scans usually. So I think if within the first, year of your presentation, you can come away and think, actually, I understand that my MS is either completely stable and inactive or it seems to be quite active. I think that's really where you want to be, because then you can be given the right advice about which treatments to have. And if you're eligible and if you want to start treatment, you're given that opportunity. So I think, yes, we do need to make sure that we're not sending people away and leaving them for months and years without treatment when their MS is active. But I think we just need to be aware, as I said, with the previous question, that there's a little bit of a balance to making sure we get the treatment right, making sure people feel ready, suitably informed, and so on. I think we should be able to do that relatively quickly, but I wouldn't want people to get the idea that by waiting some weeks or months after their diagnosis just to get all the tests ready and have all the information they need, I don't think they need to worry that time is brain and therefore they've disadvantaged themselves by waiting that short time. Does that make sense? So I think we're talking in the framework of a lifelong illness, really, with MS.
Sure, yeah, absolutely. And if someone were to sort of go through some of these tests and there's not enough evidence to support an MS diagnosis, so it might be, something like clinically isolated syndrome or something like that.
Yeah.
What happens at that point?
Yeah. So this is not uncommon. So if someone had a single event, we might call it a single episode. So they have a single bout of symptoms and they come to the clinic, then at that point in time, before they've had all of their tests, almost everyone in that situation will be, have a diagnosis of what we call clinically isolated syndrome. And what that means is that a neurologist has thought about your symptoms and your story and perhaps examined you in the clinic and so on. And they think that your syndrome, the symptoms you're presenting with, sounds like it's what we call demyelination. So it sounds like inflammation in the central nervous system that's led to some problems with the nerves in the central nervous system. So that means that they're saying, okay, I don't think this is a stroke. I don't think this is something else. I think this is demyelination and inflammation. Now, the next question is, okay, well, is this going to be a one-off, which is really what CIS suggests, or is this the beginning of what's going to end up being a recurrent theme? And that's really what MS is. So the diagnostic stuff that I've talked about, all the testing I've talked about, is really about trying to define whether someone's in the category where they're most likely to have a one-off event and therefore not need to, go on lots of treatments and not need, lots of follow-up and things, or are they going to turn out to have MS? So lots of changes to the way that we diagnose MS mean that we're usually able to make that judgment about whether it's MS much sooner than we were years ago. But still, when someone comes with a single event, if they, for instance, to give you an example, if someone came with an optic neuritis, let's say, so they'd had some inflammation in the nerve at the back of the eye, that would be quite characteristic of inflammation demyelination. So we'd say, well, this could be a CIS, but now we're going to do some tests, perhaps MRIs and lumbar punctures. And if someone had an MRI and then they had a lumbar puncture, it might be that at that point in time, there wasn't enough evidence to say for definite this was going to turn out to be MS. Now, it becomes slightly complicated because as a neurologist, you can usually give that person a bit of an indication about, okay, I can't call it MS today, but in my heart of hearts, with all the evidence in front of me, do I think it will turn out to be MS in the future, if that makes sense? So usually you can give that person an indication. Now, there are some people, for instance, who have an optic neuritis. If their brain scan is entirely otherwise normal and they don't have any other lesions in the brain or the spinal cord, and for instance, if their lumbar puncture is also negative for what we call oligoclonal bands, which is one of the main tests we look for, then I would be saying to that person, actually, your future risk of developing MS is really quite low. And you might estimate it was sort of less than 20% in the future. But if someone has an optic neuritis and they have perhaps a couple of lesions on their MRI brain scan, but either their lumbar puncture is negative or even sometimes their lumbar puncture is positive, as in abnormal, but the lesions are just not in a location that allows me to be completely definite about MS, then for that person, I'd be saying, look, I can't call this MS today because we haven't got sufficient evidence, but I strongly think that in the future, this will turn out to be MS given time. Does that make sense? So I think it is a bit of a different situation, and that's something that neurologists would always try and discuss with patients.
Absolutely. And for anyone who's kind of going through that as well, is it possible that you could look at some of these tests and then actually it could be something else other than MS that's causing some of these symptoms?
Yeah, so I think in anybody, whether they've, irrespective of their presentation, I think that the hallmarks of the, sort of diagnostic criteria are that the story needs to be compatible, the MRI needs to be compatible. Sometimes we use other paraclinical tests like the lumbar puncture. And then, the fourth thing really is that there isn't any better explanation. And actually, the better explanation thing, as I said, it takes a higher or lower priority depending on the person in front of you. So it very much depends on, the complexity of their situation, how many other health diagnoses they've got, whether they've got other symptoms that you wouldn't expect in a person with MS, you know, whether their tests are a little bit atypical, their brain scan might be a little bit atypical. So I think in certain people, you might say, actually, there are several things about you that just make me question whether we are going down the right route of MS. And actually, for you as an individual, I think there are many more layers of testing that I need to do just to look for other possible explanations. So I think that's very bespoke according to the person. But yes, for sure, for every single person we see, that has to go through our mind. And then for some people we see, because of slight atypical features in the way that they've presented, it will take a lot more work to be sure that we've excluded mimics.
Yeah, I'm with you. So just going through that process to sort of see exactly what that person will need going forwards. Yeah. A bit of a different question, Emma. If someone's sort of going through this process, then don't yet have a diagnosis of MS, but they're unwell and they're not able to work because they're unwell because of these symptoms, is there anything that they can do?
Yeah, that's right. So as I said, I really feel for people in this sort of limbo period where they've been told this may turn out to be MS, but we need to do some tests, and you know, we'll let you know once those tests are available, because as you say, these people may be living with symptoms that are troublesome and might be interfering with different aspects of life. So if those symptoms are interfering with work, absolutely yes, they should be eligible to be supported with that. And there are various ways that we support people. So in fact, that shouldn't really depend on their diagnosis. I think, you know, we would assess someone in the clinic, and GPs have a responsibility to do this as well. And if someone is deemed not suitable to do their current role, so because their, you know, vision is affected or their legs or arms are affected or something, then irrespective of someone not having a concrete diagnosis, we should be able to support them to have either time off work or reasonable adjustments at work and so on. So that really only requires support from either a GP or a neurologist or MS nurse or something. And sometimes we do that by writing a letter to whom it may concern, and we say this person's undergoing tests, but currently these are the problems that they're facing, and these are the reasons why work might be challenging. And actually, that shouldn't depend on having a concrete diagnosis. That's more just on face value according to the problems people are facing. So they could either liaise with their GP about that or with their neurologist. And I think it's useful to liaise with their employer as well, because different employers will want different amounts of information or information presented in different ways and things. But people should feel supported if they need those sorts of adjustments.
Brilliant. Yeah. So just being really open with your healthcare professionals and seeking that support if you do need it. Thank you.
Yeah.
And just a final question then, Emma, for anyone who is in this phase of uncertainty and they're worried, they're not too sure, what would you say to those people?
Yeah. So, I mean, first of all, I would say, you know, be kind to yourself. It is a really difficult phase that you're going through, mainly, as I've said, because of that uncertainty. You know, we understand that what a lot of people want in the clinic is answers, you know, and sometimes with the best will in the world, it just takes a little bit of time to make sure we've got all the information and evidence we need to give clear answers. So I think, you know, going back to what I said before, think about what are the things that are worrying you most? What are the most challenging aspects for you waiting for answers? Is it the uncertainty? And in that case, I think do reach out to some of the brilliant resources, you know, the trusted resources, so the MS Trust, the MS Society, and learn a bit about the condition, because I think usually that will bring some reassurance. Is it the practical challenges of, you know, living with troublesome symptoms while you're waiting for clarity about the cause? And in that case, we've talked a bit about, you know, how to get help with adjusting your work. Again, there might be other things that you need to reach out to family or friends and just seek a bit more support with other aspects of life for that period of time. And I think, you know, doing that is hopefully going to be a temporary thing. And then sometimes, you know, once the diagnosis is there and once a bit of time has elapsed, many of those symptoms will improve, either because, you know, they're treated, or because they get better on their own, or because people have, you know, physiotherapy or new medication and so on. So I think during that period, you know, seeking a bit of extra support isn't necessarily saying, gosh, this is what it's going to be like from now on. It's just saying, I just need to get through this period until I understand a bit more about what's going on, and then seek out specific treatments. And then I think that I mentioned being kind to yourself. I think it's okay to recognize that this is a very stressful period. And some people, I think, feel it's not legitimate to be stressed because I've not been told yet that I've got something. But I think the uncertainty is the most stressful part in many ways. And I think just giving yourself some time, thinking about the things that are going to help you manage the stress, whether it's, taking time out to be with friends and family, whether it's, doing exercise or getting away and having fresh air, or, whatever it is that is your kind of thing that helps you to relax. I think you do need to recognize that it's very legitimate in this period that you need to give yourself a bit of extra space in that way. So try and think about 2 or 3 things that are the things that help you to relax and unwind, and just try and spend a bit of extra time doing those during this period, and ask your family and friends for a bit of support to enable you to do that. Thank you.
That's so reassuring and so helpful. And thank you so much for spending your time with us this morning, Emma. It was amazing. So we will wish you goodbye. Thank you so much.
Thanks very much for having me. It was a real pleasure. Thank you.
Now, if this was a commercial podcast, this is where we would do a little advert. But as we're a charity, we're not going to do that. But we would like to take this opportunity to tell you all about our own resources for people with MS.
Yeah, and as I mentioned earlier, you can head to our website. It's obviously, of course, free to use. It's mstrust.org.uk, and on there we've got lots of information, lots of free resources for anyone who's affected by MS. So linked to this topic that we're talking about, you can go onto there and look for information around early diagnosis, how MS is diagnosed, what tests that might be done, and things like how you can best prepare for your first appointments, for your neurologist appointments, and what questions to ask. That's just going to give you that little bit more peace of mind that actually you're going to find out all of the information that you need to at that point. So please do head over to our website. Again, that's mstrust.org.uk.
It took me back listening to this, Nick.
Yeah.
It's funny because so I was diagnosed in 2007 and started having weird symptoms in 2006. But I had a granddad who had MS as well, so I knew about MS a little bit. But still, like when I first started having strange symptoms, and I've spoken about these on the podcast a few times, I had some weird tingling in my foot, pins and needles, and I also had this strange sensation where hot and cold got reversed on one side of my body. So I was standing in a shower, and it was like warm water on the left hand side and cold water on the right. I mean, it was weird. It was really strange, and I just couldn't explain it. But never once did I think that it was going to be MS. So when you go through all these tests and things, there's so much things that are just popping in your brain, and some people, we're all handling this kind of situation very differently. Some people will just kind of stick their hand in the sand and plow on and kind of not want to know. Well, I'm like one of these people that like dangerously go into Dr. Google and all the forums and everything, anywhere I could find information, and you can really scare yourself on some of these things. And also, I would say my process from first symptoms to diagnosis took about, 8 months in the total, which I think back in those days were quite quick. Now I've heard people getting sort of much quicker, which is a nice thing. But then we also hear, because of the NHS having struggles, it takes a long time between the sort of finding out, getting an appointment and then finding out the results of the tests. Because I've certainly seen a big increase in the last 2 or 3 years that I worked here, of people contacting us, especially on the Facebook group, where they will put things like, "This is my MRI scan. What is this? Is this MS?" And yeah. Nobody in our team or in the MS community can diagnose from looking at an MRI scan. That is a neurologist's job. But because you're not seeing your neurologist, you're going to feel quite frankly, desperate to be told what it is. And you know, it really is scary, stressful times.
Yeah, absolutely. Yeah, and I know we do get that quite often, don't we? The MRI scan one, and actually that just shows, doesn't it, that people are looking for answers, and thank goodness that we do have neurologists and MS teams out there that can support. And that must have been a really difficult time for you, Helena, as well, about going through the symptoms and taking that time where you had no idea what was going on. And obviously, it's interesting to hear about your granddad who had MS, because I don't know, was that never a sort of a thought that actually I've seen this person and he had these symptoms, and was there any sort of correlation at all?
Yeah, I think when I saw my neurologist after I'd had my first MRI scan, and back in those days, it was very much like going through according to this McDonald criteria, which we will link to in the thing, but which was basically like back in those days, you had to have 2 relapses, and they needed to be at a separate amount of time, and then you looked at the MRI scan as well. And so they could see on the scan, the neurologist was sitting opposite me, and he was sort of pointing at the scan and saying, look, here are some white blobs. That is demyelination or scarring. It could be a lot of different things. We call it clinically isolated syndrome, but it could potentially turn into something like MS. And I went, oh, okay, my granddad had MS. And you can sort of see the neurologist straight away starting to sort of write things down. Now, we obviously know that it's not, you don't inherit MS as such, but if you do have it in the family, there is a higher risk of it. So I think that did sort of definitely sort of make him, scribble things in my notes anyway. So, but yeah, I had to go away and wait, basically. So like Emma said, it's because she was saying about people who don't want to have a lumbar puncture. When I was diagnosed, they didn't really do lumbar puncture, so they never offered that to me the first time around. So they told me to go away and wait. But the funny thing was, in the meantime, and I say funny, it didn't feel funny at the time, I started having lots of pins and needles in my arm and started going numb in my fingers, and went to the GP, and I sort of said, is this correlating at all to my leg and the weirdness that's been going on here with the pins and needles? And he was like, no, this is carpal tunnel syndrome. You sit at the keyboard all day, you're typing, this is typical carpal tunnel syndrome, and then gave me some medication for that. And then, because it now, when you think back of it, it was a relapse and it eventually stopped. I thought it was the medication that helped because it stopped eventually.
Yeah.
But then 6 months later, when I went to have another MRI scan, I told the neurologist about this, and he said, well, there's an easy test to check whether you have carpal tunnel syndrome or not, and sent me away doing this nerve conducting test. And they found out that there was nothing wrong with the carpal tunnel nerve thing. And that's pretty much how I got my MS diagnosis. So you can, get sort of misdiagnosed along the way. So it's never really a kind of, well, I say never. For some people, it might be a very linear path, but for most people, it tend to go ups and downs. And like they said, they have to test for a lot of things to find out that it's not that as well, because there's a lot of other things that have similar type of symptoms, aren't there? So
absolutely, and that's what Emma was talking about, wasn't it, in terms of sort of ruling things out and being sure and making sure that you find out what's going on, and then you can decide on the best course of action for you with your MS team at that point if you are going through an MS diagnosis. But I think other parts of the interview, Helena, I think it was really key, that Emma was talking about, as much as you can, looking after your mental health, seeking the support of those people around you, and being open with people, as well as just reading up as much as you can from, as you were saying, Helena, trustworthy sources of information rather than certain sites or certain forums. Getting that, just as much as you can, just building your education, and what you know about MS can only be a positive thing.
And if you're listening to this at the moment and you are in that limbo land, please don't sort of think that if you see one person with MS journey, that that's going to necessarily be the same as yours, because they call MS the snowflake condition because everybody are very different. So I think that's really important, because I know my mum kept on comparing me to my granddad when I was in limbo land, saying, but you're nothing, there's nothing, because he had to use a wheelchair. He wasn't really feeling the same sort of cognition issues or fatigue or the tingling stuff that I was feeling. It was very different, and my mum just couldn't, she just said, but that's not what he was like, so therefore you can't have MS. So I think that's the really important thing, that, you know, if you do go to our website or read up about MS and sort of learn, that you'll find out that it doesn't set in stone that this is your path. If you have MS, it can turn out in all sorts of ways. So I feel like informing yourself, but don't go down a rabbit hole where this, and it's so easy to say, you know, it's like when you tell someone, don't look don't look online, or don't read stories. You're going to go and read stories, aren't you? It's just in our nature to sort of be a little bit defiant in that. But I think it's just important not to try and scare yourself, but actually really look after your mental health here, because it is really, really scary. And you will have issues where you might be having to talk to your friends or family or work and sort of say, well, I'm going through some testing and things at the moment, but they don't know what it is yet. But quite often you might not want to share that. I don't know. So I don't think I really shared until I had a diagnosis, and holding that within yourself is quite difficult, because it's a turmoil inside the head, basically. That was what I felt at the time.
Yeah, absolutely. And if anyone's listening to this who does have questions about the diagnosis process, tests, what might be happening, or ways that you might want to support yourself, please do get in contact with us. You can call our helpline team. We're available 9 a.m. to 5 p.m. Monday to Friday, apart from UK bank holidays. Outside of those hours, you can, of course, leave us a message and we'll get back to you as soon as we can. So the number is 0800 032 3839. Or if you'd rather drop us an email, you can get hold of the helpline team at ask@mstrust.org.uk.
I was actually chatting to some of the people from the helpline team just before I went in to record this, and I sort of said, what would be what would you guys say to people who are in this situation? And one thing that they were saying, apart from, look after your mental health, is to it can be useful to sort of keep a diary, which was what, Emma said, but also constantly ask the health professional what's going to happen next. So you sort of know what's going to happen next as well, that you're not going to just end up sort of, oh, this was an end kind of thing, but actually know that this is the next step, what's going on. And that could be really important. So I think that's a useful thing to end on for this.
Absolutely, yeah. So knowing what's going to happen the next stage, and then then you know what to prepare for at that point as well, don't you?
Yeah, and you'll know that you are definitely not being sort of fobbed off, or that you will be getting a new appointment and or seeing another specialist, or where the journey is going to go to. If you are listening to this on whatever podcast place you have found us on, it could be maybe Spotify or Apple or YouTube Music, we would love it if you would give us a review and leave some comments, because the more comments and things you leave or reviews, the more people we will reach. And it's especially with this type of podcast, this episode, I feel like it's really important that people learn about it, because this, like we said, is a stressful time, and it's really important to get the good information. So if you're listening to this, please help us spread the word. You can also come and give us a follow on social media. We are on all the usual platforms, so Facebook, X, Instagram and TikTok. Now, and like I said, about giving a review, this was really exciting. What happened last month during MS Awareness Week. We had a little event, and someone came up to me and sort of said, "Are you Helena? I listened to the podcast. You sound exactly like you do on the podcast." And I think I got more excited about meeting a listener than she was. But it was so, she gave us a really nice feedback saying how much it had helped her, and she was listening to every episode. So we love it if people get in touch. So yeah, you can feel free to drop us an email at comms@mstrust.org.uk as well, if you have any feedback on the podcast. But yeah, I just want to give a big shout out to her because she made my day coming and talking to me. So thank you so much to all the people who are listening and watching. You are the people who are making this podcast keep on going.